All right, welcome back to another episode of Private Practice Practically. On today's show, we have a very special guest, John Nash. John, how you doing, sir?
Oh, I am doing wonderful today.
Awesome. Yeah, things are well over here. It started off sunny, now it's raining over here. Kind of sucks, but glad you're on the show. For those of us that don't know anything about you, can you tell us a little bit about John Nash and what you do?
Yeah, so I am a clinical therapist who's been practicing for about 10 years now. I'm located in Burley, Idaho, so get to be on the rural scene here and love what I do.
Nice. And how long have you been in practice, John?
Yeah, so I've been in practice for 10 years now.
Oh, right on. Would you consider yourself a seasoned clinician?
Yeah, I would say so. I've done this in a number of different settings, and so yeah,
Right
tackled a
on.
lot of different challenges.
Good. So what is like your preferred demographic? Like who do you help the most?
Yeah, so I've got a couple different primary populations. So one is for families and couples, so I help them work through their relational challenges. And then when I am doing individual work, I work primarily with complex trauma, anxiety, and depression.
Got it. Yeah. And for people that have never worked with you, how would you describe your therapeutic style?
Yeah, so I've got kind of an eclectic style. I tend to do a lot of listening. I find that to be a really important part of it. And then as I'm listening, I will incorporate a lot of different types of approaches with that, be it EMDR, DBT, IFS. I've got a lot of different approaches I'll put in there as I'm really understanding what's going on with the person.
Is there one that you prefer to use?
I will use EMDR the most frequently.
Got it. Got it. And for people that maybe have never heard of EMDR, can you kind of give us a nutshell explanation of what that is?
Yeah, so EMDR is eye movement desensitization and reprocessing. What it does is it helps us to bring up different memories, events in our lives that are currently like causing some interference in how we're thinking, how we're viewing different situations, our life, and then we'll help ourselves to repackage those so we can see those circumstances different. We can see ourselves in a different light compared in light of that, and that allows a lot of healing to happen because we get out of our own way.
Oh, that's so good, John. So how do you know that you or your client will be a good fit for each other before you start working with them?
Well, I'll always do a 15-minute consultation call with potential clients. They'll be able to talk to me, ask any questions that they have. If we have a pretty good back and forth or understanding that I've got the right expertise to help them with their challenges, that allows me to feel comfortable with proceeding forward, and vice versa. The client also, I need them to feel like they can connect with me, share openly, and that I can be trusted with whatever they have going on in their life.
Awesome. So if somebody reads your bio, they hear about your specialties and what you're trained in, they do a consultation call and there's pretty good rapport and they decide to partner with you, what does the first session look like?
Yeah, our first session is me getting to know you in depth. So I would be asking a lot of questions about your past. What was it like to grow up in your family? What is it like in your current life? what are the different challenges that you currently experience? So I'll take a good chunk of time, 30 to 40 minutes, really just getting to know the person. And then we're going to talk about the treatment modality that's going to be best for them. Because I want everyone to be on board. I don't want to just say, hey, I'm the expert, listen to me. I want there to be buy-in, because I think that really helps the healing process to go a lot better. And so we'll take 10, 15 minutes, really, like I'll discuss the process that I'll go through, answer any questions on that if they've got concerns with that. So for example, like if someone's tried EMDR before and I've suggested, well, that might be a good approach to take here, and they just don't want to do it, I will adjust and we'll create a different plan so that they can be on board. And that's really what that session looks like.
And it sounds like you're really collaborative with your clients and you don't force anything on them. Is that the case, John?
Oh, absolutely. I consider my client to be the expert in themselves. So both the expert in whatever their challenges are, what their day-to-day experience is, and also what they think will work for them.
Yeah, that's really awesome. What has been some of the feedback from clients that actually partner with you and finish therapy or graduate therapy? What do they say?
Yeah, so my most common feedback is they've really appreciated someone who can really take the time to listen, has a good understanding of what's going on, and I don't rush in to fix things. I allow the process to play out in a way where their challenges will resolve themselves, that they gain a deeper understanding of themselves. And as that happens, I'm there to help maybe present some different things to think about, to give observations on what they're talking about, and they find that to be a really helpful thing.
Oh, that's great feedback that you've heard, John. And I think it's a testament to the quality of work that you're doing with your clients. One question that I forgot to ask earlier, John, is do you see kids by chance or teenagers?
Yeah, so I will see kids as young as 8. I'll see teenagers. It just takes a different kind of an approach the younger that you go, and I prefer to really focus on specializing in the areas that I do work.
Got it. Yeah, that makes a lot of sense. I like to switch gears a little bit, John, and ask about you. Is that okay?
Absolutely.
So outside of the therapy office, what do you do with your time?
I'm a big family guy, and I've got a wife and 4 kids. Kids range from 1.5 to 11. And so most of my time outside of work is helping them with different things around the house. When I do have some moments to myself, you'll probably find me building Lego sets. That's a big passion of mine. My home office has a whole wall behind me of Star Wars and Marvel Lego sets. I like the outdoors and disc golf. I'll do a lot of disc golf when I have the time and the weather's good. Right now is not the time for that.
Yeah, awesome. John, what motivated you to become a therapist in the first place?
Like most therapists that I talk about, I had some different challenge points in my childhood, and surprisingly enough, like I had some pretty negative experiences with therapy initially, And so I was pretty turned off to the idea of therapy. And then I would say that I had a turning point when I was probably 23, 24, somewhere in there, where I had some different spiritual promptings, go ahead and try some therapy again. And you should really consider that as a career path. And that really surprised me. I had tried a number of different career paths before, engineering, which is very different than therapy, thought about some other medical pursuits. And I was really nervous because I am introverted by nature. But when I had some of those other positive experiences with therapy, and I really got into some of the psychology classes just as an undergrad, it opened up my eyes to how helpful this could be, and that really I just hadn't had the right fit. The right approaches weren't taken with me, and I hadn't really bought into the process. And so that was a really significant turning point, like I said, and I haven't looked back, and now I couldn't see myself doing anything but being a therapist.
Wow, what a great story, John. And something you said really stood out to me. I think if I remember correctly, I think you said something like spiritual promptings. Is that what I heard?
Yeah,
Do
yeah.
you mind sharing a little bit of what that was, or what those were like, if you don't mind?
Yeah, so I had been praying a lot because in that process of figuring out what to do, I had kind of exhausted all of the time I had in college without going full in on a major. And so there was a lot of prayer, and for a time I didn't feel anything. But then when I got those promptings, it was some pretty clear thoughts in my mind at first that I felt didn't originate from me, because I had never considered the therapy route before. So that was one indication for me. And then a lot of my spiritual promptings come, first as a thought and then a confirmation through a pretty distinct feeling that I have that is separate from any other emotion. And kind of this warmth I feel. It's what you're thinking is right. Everything just seems to line up. And that's how I know it's a spiritual prompting and not just me having some thought of my own.
Wow, John, that is incredible. And I wonder, how does that influence your practice at all? Like when you're kind of at home, maybe thinking about your client or thinking about the treatment, do you kind of sit there and listen for those promptings?
Yeah, I will not only listen for those promptings throughout the day, I will invite those promptings to come in throughout the day. So I start off my day with prayer, and especially if I have some clients that I might be seeing that I might be a little bit unsure about what I specifically need to do, I will ask that I will be guided throughout the day, and I will have some of those small promptings that will guide me in different questions that I ask. Or sometimes it's like, John, just shut up and listen right now. You don't need to say anything. That's really important when they need a moment to just sit there in silence and process for a moment. And I have this thought that I think is great that I want to share that might be helpful.
Wow.
And
Yeah, go ahead, John.
and when I do that, great things come out. And I'm always glad that I've listened to those promptings when I do.
Wow. Yeah, that's incredible, John. And that certainly is a gift, I think, to be able to um, listen and invite those promptings in and be in tune with yourself. And it sounds really cool that it influences your work, or I'm sure the clients benefit from that. Um, John, I wonder, what's on the horizon for you? Are you thinking about maybe hiring another clinician? You open up another location? Do you have a book out? Maybe an online course? What does that look like?
Oh, kind of a little bit of all of those. So I released a book a year ago, and it's called Inviting Christ on Our Healing Journey. So this is something that combined a lot of my two biggest passions, right? Christ and his role in healing, and therapy and what that can offer. And so in this book, I have been able to blend those in a way that I think can be really helpful for individuals who also want to have both of those work together. I've found that there's a big need for that, and it's just not getting filled the way that it's needed to. So I wrote this book also off of a distinct prompting that I should, and I followed promptings all throughout writing this. So I believe fully in what I've written here.
John, what was the experience of writing an entire book like?
Overwhelming when I was starting. Like, I feel comfortable writing a 20-page paper. That still stretches me. That was my mindset going in. But as I followed those spiritual promptings, things just came together in a way that I would have never expected. I had anticipated needing to set aside large chunks of time to be able to get the writing process going, and it to take probably a couple years to put this together. But when I found myself to be spiritually in tune, the words just flowed in a way that my normal writing process doesn't work. And it took 7 months from when I started putting the outline together to when I was submitting my draft.
Wow. Yeah, that is pretty fast. That's incredible, John. When you were done with your book, what was that like? Did you feel relief, or were you happy? Like,
When I held my book in my hands after all the editing process, and that was an amazing feeling. I felt a lot of joy, a lot of satisfaction, accompanied by some nervous feelings of, well, now is anyone going to want this? But first, like, it was just a lot of joy seeing that finished product in my hands.
wow. Yeah, that's awesome, John. Sorry, I didn't mean to cut you off. Go ahead, John.
Oh, you didn't cut me off there.
Okay, gotcha. John, what has been the feedback so far from people that have read your book? And do you recommend it to your clients? Is that something that you offer as part of your practice?
So I have my book that sits on a shelf. People are able to see it. I don't necessarily offer it as like part of our treatment, like as a recommendation to them. If they ask about it, I let them know how they can get it. But I want to be really careful that I'm not crossing any lines that I shouldn't. But as far as feedback that I've gotten from people who have read it, it's all been positive so far, that they really like the the format of it. They feel like it helps them to connect. There's a lot of personal experiences in there, both from myself and from people that I know, and they really appreciate that helps them to connect with the principles instead of it feeling like a traditional self-help book that's just going to tell you what to do and kind of leave it at that.
Interesting. Yeah, that's so good. John, I like to come back to the horizon. So we talked a little bit about your book. What about your practice? Are you looking to hire anybody? Are you growing any locations?
Yeah, so I actually just recently moved into this area and have already seen a lot of growth in my practice. So the empty slots that I had when I left the other location that I was at to move up here, those have all been filled. I see a big need here. So if there are any therapists in the Burley area, we would be interested in hiring. We've got space here. There's definitely room for filling up.
Yeah, that's great, John, and it's really awesome that that you went to that area where there was a need, and I'm sure that you're an incredible resource for the community and the people that need it. If there's a person that's watching this episode and they're kind of on the fence, they're like, oh, okay, John sounds cool, and but they're still a little reluctant to reach out to get some help, what would you want them to hear?
Give it a try. The worst thing that can happen is to leave a resource that could really help you on the table and not even give it a try. A 15-minute consultation costs you nothing but 15 minutes of your time, and just give it a try. Also, if it's not the right fit, that's fine too. And there will be ways that you can get help. Being nervous is understandable. I am nervous when I try to find a good therapist for myself. It's not always easy, and I've been doing this for a while. There's just something about making that call. Like I resonate with people who are nervous about that, a little hesitant. But it pays off to try out your options and just see if it'll work.
Yeah, definitely. John, if let's say a client reaches out and it's not quite the best fit, do you help that person maybe find a therapist, or how does that kind of play out?
Yeah, I will always provide referrals. So what's nice is I'm part of a large practice, and so we've got people in lots of different locations in 8 different states, and so there's almost always someone else I can refer them to within the practice. But I always try to keep myself connected with different resources in the community, and that way I can refer to someone else who might be a better fit. And I totally respect that. I just want people to get help.
Yeah, absolutely. John, thank you so much for being on the podcast today. This has been a great conversation, and maybe we could do it again in the future. How does that sound?
That sounds great.
Awesome.
Love talking with you.
Heck yeah. Thanks again, John. All right, everybody. Till the next one.